relates to items 1 and 2.
Look, 1 and 2.
Okay. All right.
I do have a question on what's the amount on item 1?
Okay.
390,000.
How much is it?
390,000.
All right, very good. Okay, has been moved and properly seconded. All those in favor, let it be known by saying aye.
Aye.
We have no District 1 other business, so thank you all.
Mr. Claxton, Community Development and Human Resources Services Committee. Ms. Green, Mercy Health Service.
Good morning, Commissioner.
Good morning.
I will skip all the way down to our family court. We have something from family court. James Fields.
Hi, good morning, everyone. We recently received a court improvement grant through the through the Administrative Office of Courts of Alabama in the amount of $29,300. The reason for the grant is to improve the quality of services for our at-risk youth that are experiencing drug-related issues. We've had a continued struggle in trying to appeal to that demographic and get them on the right road. So hopefully this grant would not only work, we will work directly with the children, but our goal is to enhance the quality of services by going into the homes with this particular demographic. So we are looking forward and excited about what this grant potentially can do for our clientele.
I'll move.
It's been first and second. All in favor?
Aye.
Aye.
Thank you.
Thank you.
We have, thank you so much, James.
Second.
Third.
Okay, our community grant has been first and second. All in favor, say aye.
Aye.
I have a presentation from Aspen Criminal Justice Reform Institute.
And Commissioner, this was on the agenda somehow, some kind of snafu in the minute track kicked it out, so I apologize for that. It was intended to be on your list, but it just didn't get printed. Sorry about that, Mr. Thompson.
Okay, can we have, Doug? Yes, sir. Doug and Mommy, so he can step up with him. We had the pleasure of me and Mommy from the county to actually go to their institute classes. I'm gonna say it was classes because they didn't give us a break. They made us. It was mandatory to attend all of the classes. You had to get past the bears and everything to get there. But it was very informative, and I learned so much. The city of Birmingham sent a team of people. We had people from commissioners from South Carolina, California. That was just from all over. That when we went, I just want y'all to hear this whole thing. It's very interesting and it's very doable for Jefferson County.
Well, thank you so much, Commissioner Tyson. It's a pleasure to be here. I was walking around last night. I didn't know the SEC was right there. You know, I'm from South Carolina, but we love Alabama also. Thank you so much for this kind invitation. It was great to have a delegation from Birmingham and Aspen. My name is Douglas Wood. I'm director of the Aspen Institute's Criminal Justice Reform Initiative, and we are working very diligently with other partner communities across the country to really think about how do you mitigate against violence in neighborhoods with overlapping poverty and high incarceration rates. And we have seen a lot of the great things that Birmingham has been doing to try to address issues of public safety, and wanted to come to Birmingham to have a conversation, starting with the mayor's office and the city council, and particularly Councilor Tate, to think about bringing, in partnership with Birmingham and Jefferson County, launching our Justice and Governance Partnership with you here. My partner in this work is a man named Eric Kadora, who's head of the Justice Mapping Center. Eric's work is really well known nationally because he was the first person to do what he called the $1 million blocks in Brooklyn, where he did an analysis of how much the state of New York was paying to send people to prison per block, and it turns out that the state was paying $1 million to send people to prison per block in Brooklyn. And so his work is really around doing an analysis using justice mapping techniques to look down at each neighborhood using census tract data. And so we think it's important, in order for us to be able to address public safety, is to be able to have the data and the information to make the right decisions, and then use that data to reinvest in those neighborhoods to mitigate against different types of violence and to increase public safety. So with respect to the PowerPoint, what we found across the country is that many jurisdictions have fragmented data analysis, disjointed policymaking, and marginal community engagement. And what our work around the justice audit work is to actually work with these communities to actually come up with a data mechanism that is actually anchored in what we call the justice audit. Next slide. So our partnership is anchored in the production and review by each local jurisdiction of an annual justice audit of the wider justice ecosystem. What I mean by that, it's not just the criminal justice system. It also includes gathering data around housing and health and education and employment, all of those issues that really are very much associated with issues related to violence and public safety. So it's designed to be systematically repeated each year. It brings together and mobilizes data from a diverse coalition of stakeholders, and it uses interactive visualizations and hyper-local data mapping at the neighborhood level, which is easily accessible to everyone, from public officials to educators, and immediately relevant to constituents in each neighborhood and district. So this gets down to the neighborhood level. So our expected impact and outcomes with regard to this data: an increased network of community-based public safety and violence prevention activities, reduction in the punitive justice footprint, reduction in the critical healthcare footprint, reduction in the residential and family crisis footprint, because we'll be using the data to be able to think about how do we reinvest back in those particular places where there are challenges in those neighborhoods. Next slide. So we'll be gathering data on the entire criminal justice case processing, which includes all of the data, working directly with police and the sheriff's office, legal services, district courts, the jail, probation, all of that. And we'll also, next slide, be gathering data on what we call the crisis management footprint in most of these neighborhoods. That means we'll be doing an index, which will mean getting information on prison admissions to evictions, to substance abuse, to school arrest, to foster care placement, to all that stuff, because, you know, every time there is a shooting and someone goes to an emergency room, there is a cost to that. So we want to be able to see what those costs are in order for us to think very critically about justice reinvestment. Next slide. We'll also be doing asset-based information, gathering information about neighborhood services and programs, housing services, health services. You got to see what's actually going on the ground. So that will also be a part of the justice audit that we'll be able to use to make justice reinvestment plans in these neighborhoods. Next slide. Now, what we think is important about the mapping is that, you know, folk understand maps. And if you see, we've already done a preliminary analysis in Birmingham, which we'll also do with the county. So 12 zip codes account for 20% of Birmingham residents, yet 45% of Birmingham jail inmates. Now take a look at where the pink and the red is. Next slide. You see right above that, where the jail inmates by zip code or residents, you also see right on top of it the percent of population with diabetes by census tract of residents. I mean, they almost exactly correlate with each other. Next slide. Same thing. Percent of population without high school diploma by census tract of residents. Almost exactly on top of each other. We can do the same thing for the county. Next slide. Median household income census tract. And by the way, the lighter version is the median household income is $14,000 to $30,000. When you see the light gray right there, it's right on top of where the jail inmates by zip code or residents are. So it's very clear to us about the importance of this work and using this kind of technology to make reinvestments in those neighborhoods and to mitigate against violence and to think about prevention. What we've done so far is, just to give you a sample of what this is, we're very happy that the city of Birmingham, per Councilor Tate, has invested $250,000 into this program, and we are excited to be invited by Commissioner Tyson to also apply And that's, by the way, ARPA funds from the city, $250,000 already the city is going to put into it. We're invited by Commissioner Tyson to also apply for ARPA funds to the county, which we did on October 14th for a matching of $250,000. So that first $250,000 will cover the planning period, which you see there in stage 2. And we are asking Jefferson County through the ARPA application to invest in the first initial half of the implementation, which is stage 3. So the beauty of it is we could get starting in Birmingham and in the county with a very thoughtful planning and initial implementation with the match from the county with the city. So I will open it up for any questions. That was quick.
I told them that we have quick meetings. So, I do want to say, in other states, this has worked. You can see the number of the crime number go down in these states that had participated. That's what attracted me to this program. From Texas all the way to, it was Compton, California. What was that? What was it?
Yes, exactly, Compton, but also in neighborhoods in New York as well.
In New York. So once I seen that, and I was actually had an opportunity to talk to the commissioners there, because those are the people who I was actually dealing with in those states. I had a chance to go in Compton. I actually had a chance to go and tour, and I seen where they built the YWCA in a community. They actually just have totally changed their community and the programs that they actually put in there by mapping the program. And I would like for us to take a really serious look at this and try to partner with the city on this. And I know that the city of Birmingham is actually in me and Commissioner Scales' district, but this can also be done in the other areas of Jefferson County. We do have crime in other areas besides Birmingham that's a part of Jefferson County.
What would be the scope of if we engaged them?
Well, we would actually.
Unincorporated county or any of the other municipalities, or is just
We would. Our focus would be the city of Birmingham and Jefferson County. So it's this whole area. It would include Jefferson County and Birmingham. It's the scope. Very similar to what we're doing in South Carolina. In South Carolina, we're working in 17 counties. They're the poorest regions of the state. So we think it's important for us to be working in mid-sized, micropolitan, and rural jurisdictions, but we have a lot of expertise, not just the big, like the big cities.
And this just maps out where the criminal element is, I guess, originating from, sort of.
Yeah, well, what it does is it allows us to go by each neighborhood,
right,
including not just the city but also the county,
right,
to determine and to see where there is high rates of incarceration, high rates of poverty, high rates of violence, high rates of shootings, all of that stuff. So we'll be able to get a sense of what it is. But it also is putting a cost index on all of that. So instead of sending folk to the emergency room for shootings all the time, you can think about how you reinvest in the neighborhoods so that you mitigate against that violence. And so it's not about more money. It's about using your money much more smartly to mitigate against these things that cost more money. And let me just say one other thing. We're not working in Chicago, but Chicago actually used our model. There was a great article in the New York Times back in July where it talked about how 97% of the violence that happens in Chicago happens in 4% of the blocks in Chicago, which means it happens in 6 neighborhoods. And see, just having that information and that data is important, because then you can start thinking about, first of all, what is the cost on all the shootings, on emergency services, and housing insecurity, all that. And instead of putting all that money that way, how can we think about how we can put assets back into the community to make sure that doesn't happen?
What I see is it looks like you're looking for commonalities within those neighborhoods where the crime exists. And you're going to put resources to try to alleviate the problems that exist in those neighborhoods?
Yes, but it's not about necessarily new resources. It's about how you reallocate.
Reallocate.
Instead of spending all that money. Because, you know, it's amazing. You all know, you're public officials, the cost. The cost is associated with all those things that's listed on our crisis management index. All that's a cost. It's this cost when kids drop out of school. There's a cost associated with that. We can actually put a number on that. And so instead of saying, we're not talking about more money, we're talking about how can you use the money more efficiently and more targeted and more smartly and better.
Like even with the mental clinic that they get ready to open up, that they're building through Jefferson County, the Sheriff Department, that going out into that area where the numbers are showing where that is being affected in that area. The GED program showing where those people that's being incarcerated that's causing this crime, they're not are graduating from school. They don't have a skill. So we're going to put our resources with workforce development programs, with Lawson State GED program. We can actually put them there to actually go into that community and get the people who are committing these crimes, are people that might commit a crime, that doesn't have a degree or a skill, that's not working. We can put the programs over there to actually inform those people and find those people, even going through the churches, the gym, the recreation centers, the YWCA, football, community leagues, baseball leagues. It's just all sorts of resources that we have, and even with the food deficiencies that we have found, we can actually put that there. We know where to go. We would know to go to West End for that.
So it sounds, let me ask my question, Jimmy. So it seems to me that this is a data-driven program.
Yes, ma'am.
And so basically, I'm just going to articulate what I'm hearing in short.
Yes, ma'am.
So what you're doing is you're making everything data-driven, so you assess the needs, and then you reappropriate those funds in order to be able to address the needs accordingly.
Yes, ma'am.
And you're also saying, in addition to that, is that we can take this data and use it for other purposes when we're trying to do some things to empower those communities that are underserved.
You got it.
Okay.
As my grandma would say, you boiled it down to the low gravy.
We have a big old pot.
Oh no, when it comes down to money, I know how to make it scoot to the top.
Let me ask you this.
Well, hold on, Joe. No, I wasn't finished. So that being said, I think what this commissioner was asking is that the county covers 35 cities, which also encompasses Birmingham. Right? So, two questions for you. One is that will it overlay all 35 cities within Jefferson County? Is that the attempt?
Yes.
All right. And do you think the $250,000 will get you where you need to go with that kind of range?
Excellent question. Excellent, because
It's only effective to the degree it's funded.
yes. So if you look at that slide that we have right there, what we keep in mind, we want to keep capacity here. So that means that money, is $650,000 is what we are, is the total cost of it per year, because we want to have a full-time person, we want to have a data scientist, we want to have a policy analyst, we want to have support there. So we need the money for the local investment. But don't forget, we have also other foundations who've invested in the other portion of it, meaning all the technical support that, partly from Justice Mapping Center and Equal Measures, our evaluation team. So, we are now funded by the largest criminal justice funders in America, which includes, the Ford Foundation, the Balmer Group, also Arnold Foundation, Bank of America, all of that. The total cost is more expensive, but keep in mind that the local part of it is $650,000 per year over that time period. And so all we're asking right now is to get started with the work by having the city pay for the planning period and also start to ramp up with this another investment on initial implementation. Because remember, the money is going to be going back, this part of the money is going back to a local justice intermediary, the vast majority of it. That is where the justice audit is going to be handled and anchored.
Who handles the audit?
Well, the audit is actually administered and helped, the Justice Mapping Center will be working directly with the local justice intermediary to do the audit.
Right, so who's the intermediary?
Well, see, that's a good question because that'll be the choice of the planning and leadership group of Birmingham and Jefferson County. That's your choice. It's not our choice. What we'll do is, for example, in Grand Rapids and all the other places we did, the planning and leadership committee will select the host organization during the planning period. And then the Planning Leadership Committee will also select a local justice intermediary. And we have a whole RFP process related to that so that there's organizational capacity, it's thought very carefully, there's quality control, all of that. So it's not us somewhere in Aspen doing this. It's actually a local justice intermediary here in Jefferson County and Birmingham who will be leading the work along with the Justice Mapping Center. Now, here's the other beauty about it. The Justice Mapping Center will be producing the first justice audit and justice reinvestment plan with the local justice intermediary, but then hands over that responsibility. So this is done on an annual basis by them. So you leave local capacity on the ground where you have a data infrastructure that is cross-sector, that you have the ability to do this over and over and over again. So we work ourselves out of a job so that you have that capacity here on the ground. Now that's the difference between most of
I
our
get what
work.
you're saying. You start it off, and then you hand the baton over, and then it's left up to that local municipality or whatever in order to make it work. It's on them to execute it. Your
Yep.
job is to get the data.
Right.
Their job is to execute what is needed from the data.
Right, exactly,
And
exactly.
then Commissioner Scales, the city of Birmingham have also put money over at the health department. How much was it, Brandon Casano? And can tell them who you are.
Good morning,
Good
Commissioner.
morning. Good morning.
Brandon Johnson, Director of Policy, Mayor's Office, City of Birmingham. So we've also invested a little over $2 million, I think $2.3 million with the Jefferson County Department of Public Health for the hospital violence intervention, but that also will have a data component to it that will be pulled in with the justice audit and all that other information. So we're looking to also, in addition to the $250,000, support this through other funds and efforts as we move forward.
And we will also, Commissioner Scales, we will be pulling in Monique from our youth detention. She will be pulled in along with with our fundraising efforts of pulling in other money from the Ford Foundation. Me and Councilor Tate have met with several different agencies about this. And we are in the process of getting together where we can write grants and apply for this other funding that's out there, and where we can bring in youth detention, which the county is over. And Monique will have a big part in that.
Commissioner Sexton, we'd be remiss if we didn't thank the city of Birmingham for the $225,000 contribution they made also over to the Family Resource Center, Family Court. So Commissioner Knight, when I presented a couple months back, you were asking who else was partnering with us and who else was helping out financially. The city has stepped up and made that contribution. They're going to fund this pilot initiative. And so that is already underway as we speak. And so they have most definitely put some skin in the game.
So let me just say this, and then I'll be done. Because being that we do have media here, and good to see you, Cynthia, this morning. I saw your mouth asking what brought her here, so I'm sure it's about good news, right? Okay, and since we do have Birmingham Watch over there as well, so for the record, yeah, I mean, I'm putting my PR antennas up because here's the point: what I don't want to get out. Our sheriff is doing a good job.
Oh, absolutely.
Oh, hold on, let me finish. And what I'm saying is, Birmingham should have skin in the game because most of the homicides are coming through the city of Birmingham, not across Jefferson County. Okay, they're happening, in certain areas, but it's not like the majority of the crime is Jefferson County. Birmingham makes up the majority. Birmingham should put up money. Now, I'm speaking for me. I'm not speaking for no other commissioner. And I don't take it back. You can quote me on that. Okay? They should have more money in as far as I'm concerned. Because the sheriff cannot take care of every single city, but he has done a great job in making sure that he tried. Okay? So that being said, I would like to know, you know, after we get past $650,000 initially, how do you sustain it? Because you got to have some sort of sustainability in order to make it work. And I do want to be clear, and I'm going to be done with it, is if you apply for $250, there's a difference between the city putting in $250,000. I'm not just talking about through a council member, but if they put up $250 and yet we comprise, of 35 cities, right? I think the ask should be greater. But I guess what you're trying to do is to have an initial ask so that it can be on a performance basis, and then you come back next year with more money asked. Because other than that, to start a program, but it has no real lifespan in it, you're just doing something. So I'm looking hopefully that there's going to be a continuation. I'm sure that's what the commissioner is thinking.
Yes.
And so we can move forward on that.
Yes, even with the state commissioner scales, I have had an opportunity to talk to the state, the representatives down there, and they are very interested in the program. Once they found out about it and they had the opportunity to really look at it, they want to move it to other parts of Alabama. I said, but we're going to wait a minute. Let's see what we can do in Jefferson County first before we even consider even moving it. You know, let's get it started here. So they are very interested in this program, and the effort of raising more money would not only be for the county and the city of Birmingham. They would actually have a board to actually do that also.
But you're right, we'll be coming back.
Yes.
Oh, well, that was going to be my question too. So I've heard 250,000 ARPA. I don't know if it's been run by Little Brian or not. And then I'm hearing 650,000. And then I'm hearing year after year after year. Is there an end, or is it perpetual?
Well, for us, in terms of our engagement, it is that initial 5 years.
5 years.
Yeah, because, and we've already started with the stakeholder engagement here. You see in that stage 1 up there?
And is that at 650,000 a year?
So it's 650,000 a year, and that is for the last part of the 2 years there, plus the 250. So it's, you know, we're talking about 4 to 5 years of work. So it ends up being about 3.2 million overall.
There you go. To the county.
No.
No. Now, he didn't say that,
I'm just asking.
Commissioner,
It's 3.2 for the county and the city.
as a whole.
As a whole.
And, okay.
Well, and ARPA runs out in
Yes.
2 years, so
Yeah.
Right.
what, to sustainability,
Right.
what does that look like after
Well,
that? And I'm not saying, I think it's good, and it's good information that we need to have.
Did you hear him call out all those foundations? He called out all the foundations along
I
with
mean,
that.
what would our investment be each year for?
We're looking for crime to go down, not go up.
Now,
So
about
as
dollars.
I know, as the crime go down, the dollar amount go down.
And you got to think now that all these other cities outside of Birmingham, that we should require them to participate also.
I talked to the ones in my district to see, and they have small amounts of money, but they are willing to invest.
You know,
Because they do have crime in those my two cities, and they investment even said that they wanted to hear the presentation. I'm going to take him over there,
Okay.
and they are willing to invest.
Yeah.
They want to hear it just like I brought it to y'all. They want to hear the same thing.
And it's a good program, and if everyone comes in and has skin in the game, we certainly do appreciate you. Appreciate you coming. This is an exciting program.
And, well, and
Thank you.
since it is exciting, Mr. President, then what I would highly suggest, I'm not going to put it on you because you work for him. Okay, what I would highly suggest, sir, that you do is that do a tour of all of the cities in Jefferson County, because here's what I know. You may start out in underserved areas. I have a sister that lives in Chicago. You may start out with the criminal element being more predominant in underserved communities, but they always land up where the money is, right? Which is the communities that are impacted but not so much, right?
Right.
So if we're smart, I would think that what you would do is go and visit those other cities that would want to be more proactive and more preventive, so that they're not reactive. We're responding in our districts. You get it? But if you're doing preventive efforts, I think that they can have a slim skin in the game, and yet they're helping to support proactiveness, and that ends up being your approach for these other cities to participate. So then, therefore, those cities like what we have, that they may be challenged with their budgets, their fiscal budgets, then this can help underwrite some of that.
So Commissioner Scales, today, he will be here today. I will take him on a tour today. We have a tour scheduled today. He will come back once we gain the support, and we will go back and he will come back and we will tour the other cities with appointments. Right now, we have appointments in four different cities.
Okay.
And may I just say one thing to Commissioner Knight? Remember the reinvestment aspect of this in terms of the cost.
I understand that,
Yeah.
but I'm trying to get a handle on what our initial investments.
Right,
will
of
be
course.
over the 5 years.
Yeah, understood.
I'm still not sure I have that. Yeah.
Okay.
We appreciate you coming and giving this presentation. I have a challenge going for you.
Oh, my goodness. Thank you.
I want you to keep that
Thank you so much.
in all your travels, and remember the good folks here. Okay?
Always. Good to see you. Thank you.
Appreciate you coming.
Thank you.
Okay, guys, Administrative and Infrastructure Committee, Roads and Transportation. Good morning.
I'll move 1 through 3.
Second.
All in favor, say aye.
Aye.
County Attorney. Got a minute from the commission meeting on October 20th, and I'm sure everyone's read. 1 and 2 has been
Second.
moved and seconded. All in favor, say aye.
Aye.
County Manager.
First one, Commissioners, is the ARPA lost revenue resolution. That's to relocate that money to help offset payroll. The second one is a resolution that acknowledges and benefits you have set up a bucket of money for the outdoor recreation and supports the Greenways Commission's endeavor, which includes Red Mountain, Turkey Creek, and the Ruffner Mountain. Third item is Administrative Office of the Court. You approved in the budget each year to supplement the bailiff salaries. This resolution just moves that money over as per your approved budget.
Move 1 through 3.
Second. But I do have, let me ask you something. So the choices that were selected, is there a process by which you did that? I'm talking about those. I'm talking about the item. Hold on just a minute. Let me make sure. This is about the parks, like Ruffner and so forth. Did you have a process by which you
Yeah, and
went about that?
this one does not actually approve the money right now, but it does tell these folks that you have approved a bucket of money for outdoor recreation. And if, when they actually apply, that this would fit that need. So it doesn't say you've approved it yet, but what they're doing, they're trying to raise other monies, and they kind of want to see that you have set money aside for this purpose,
Okay.
and it's available. They will have to come back, you will have to do another contract, or you may choose to not approve it.
You're just making sure that funds are set aside, and just
They're-
in the event that they do become eligible, then they can move forward.
Right, and they need this to raise the other money, because they feel like if they got your support, they're gonna get another chunk of money from some other folks.
They're applying through the state also to try to get, 2 million.
1 through 3.
Second.
Move second. All in favor, say aye.
Aye.
Aye. Other business, we have St. John Baptist Church recognition. Is Amelia here? Is she that's going to be in our, that's to be placed on the agenda for Thursday. Mount Olive Community Center appointment of Mr. Royce Matthews to that board.
We want to.
1 and 2. Move to second. All in favor say aye. Aye. Commissioner Knight.
What is St. John Baptist Church?
It's a recognition of them for their longevity. It's actually in the Dolomite community, and I've always helped them. And it's now in Commissioner Scales' district, but you stepped out.
All right,
Wait a second.
But I just want to make sure that you include, and you can pass it here in the meeting, that we need to set a meeting for November 16th.
November the 16th, we do have to set that
Did
meeting
you?
of the organization.
That's according to statute, that's up to you, 9 o'clock, but that's your statutory requirement for your
I
first
don't
meeting.
want to, at the end of my program, to ask that.
Yeah.
No, that's the,
When will we swear in?
It'll be that day, that'll be you guys.
So why don't we do
Joyce.
the meeting,
we could do it at 10, or we could do the meeting at 9. That's up.
It's when, yeah, it's,
well, you gotta get sworn in before you can really have that meeting though, right?
well, once you've been duly elected, you're kind of sworn, you take office on that date, you can have your formal swearing, however you guys decide to do it.
It's just,
And I figured that we wouldn't need to go up to the courtroom or anything, I would just do it on the day.
what,
Swearing in,
Are you gonna do a reception? I ain't doing
we do that afterwards.
nothing. You ain't want no more cold
Nice.
food.
Yes, ma'am.
Let's cold
right,
water music.
Yes, ma'am.
maybe we should have the reception first.
Oh, yeah.
That or swear in with a bit.
But,
Yeah, mine is as we set the date, you all can get the.
Yeah.
We got it. I want to get the legal part out.
That is, should we not get by Mickey Mouse and Nick Saban?
Yeah, we need
Have it
to,
right here.
that would be new business at this point, since it's not on the agenda. If
So
somebody.
I move for unanimous consent.
Move for
Meeting
unanimous consent, all in favor say aye. Aye. Move to,
To
that's
accept
on the
what Theo
motion
said.
for the organization.
You
All
got
in
what
favor
Theo
say
said,
aye.
right? Aye.
Aye, there we go. Now. Commissioner Knight, your turn.
Finance.
Wait a minute.
Oh.
We got a CAPT board meeting at 9 o'clock on the 16th. And we really need to pass that because it's our money for the youth program. And the money, there's several other grants that need to be moved out there.
What now?
On the 16th for, CAPT for,
Workforce.
workforce development.
Well,
And we got to have a form. We might not have enough people.
why don't we do that right before we do the organization in the same meeting? Can we do that, or does it have to be done after?
Captive board meeting, where is that located?
But you're talking a separate meeting, right? Yeah.
Yeah.
It's at workforce.
You should put down.
This is.
9 o'clock.
Nah,
Probably
it
about
should
9,
take
by
no
10
more.
o'clock.
Nah.
Should be done by 10.
So we'll make, why would you set our meeting at 10 then? That work? That take care of you?
Yeah,
10?
they'll get me back in time.
Move to set the meeting at 10.
Yeah.
We need to
10 on the
vote
16th.
that. All in favor, aye. It's unanimous.
Here we go.
Ms. Dixon.
Now, Joe.
Good morning, Commissioners. We have our unusual demand report, item number 1. Item number 2, 3, 4, purchasing exception report, purchasing agenda report, and encumbrance report. Item number 5 is our procurement card statement for Jefferson Credit Union. Are there any questions?
Have a motion? Have a second.
Second.
All in favor, please say aye. All right, we have multiple staff development, individual staff development. There was interesting on there, but I think I know what that is. Do I have a motion?
Move it.
Motion and second. All in favor, please say aye. Aye. General services.
Move 1 and 2.
Good morning, Commissioners. General Services has one item on the agenda. It's the amendment to the industrial fire and safety equipment contract. We're adding 2 locations. It's the satellite offices, Hoover and Gardendale.
Let me ask you this. Do you have Jack and Joe's still on your
It's
agenda?
This pool.
Jack and who? Oh, no,
That's
yeah.
full. Well,
It's been moved, Trish.
all right.
Okay, thank you.
Motion.
That's
All in
it.
favor, please say aye.
Aye.
So the Jack and Joe's is full. Okay. Didn't have that. Okay. All right, I have, a bunch of stuff, here, grants and public service grants. We've approved the budget. Have a motion, second, all in favor, please say aye.
Aye. There you go. All right. Information Technology and Economic Development Committee.
I have one item and then a brief presentation.
Second.
All in favor, please say aye.
Aye.
John, you got the board member. Thank you, Craig. Secondly is, I mentioned this at the last meeting, the ambulance study coming off of the Fitch report. Everybody remembers the Fitch report that we received in August. The takeaways from it were that we needed to look at the report and then decide what the follow-up items needed to be. As we looked into the Fitch report, it was not necessarily as complete as we would have liked. So we dove in and had had deeper conversations. First of all, we went and invited all the fire chiefs from Jefferson County to come and have their voice heard. We met with them. We got a lot of really good feedback. I'd say about 90% of what we heard and some of the resolutions probably came from that meeting. I do need to introduce, before I go too much further, kind of the core group of the folks that were a part of the process. We had a lot of folks that were part of the process, but the core folks, Jim Coker with EMA, Jim St. John with EMA, Donnie West with Jefferson County 911, and Greg Silas with Birmingham 911, and Chris Willis from Jimmy Stevens' office. As I calculated it up, that means you guys are really old. It was over 120 years in law enforcement, fire and rescue, and communications for public safety. They've served as anywhere from chief to firefighter to paramedic, every version of law enforcement, including a yellow brick from the FBI Academy. So a group that is very well educated and understands the needs, and have been a part of every meeting that we've had. The critical findings coming out of the Fitch report were delayed or no ambulance response, chaotic 911 call system, and EMS not recognized as an essential public service, and there's no single entity that's accountable for EMS countywide. Through that, we met with the fire chiefs, we met with Dr. Wilson at the Department of Health, we met with the for-profit ambulance service, global medical response, which we'll touch on here in just a minute, our local colleges, specifically Jeff State and Lawson State, who provide education and training for EMS and paramedics, our workforce development staff of Jefferson County, and the Alabama Department of Health with Dr. Harris and Jamie. Is it Jamie Harris? What's Jamie's last name? With EMS State. Right. With Alabama, under the Department of Health, EMS statewide. Some of the main items that we found were in state law as we look back through it, that counties and cities are not obligated to have police or EMS. There's no obligation there. However, if a city or a county takes on that obligation, or a fire district, then they are obliged to not only have fire protection, and if they choose to, they could have EMS. But again, it's not the responsibility of the city or the county. We recognize that there are a number of different, there are probably two bigger options or obstacles. Number one, we know that Western Jefferson County is more rural and the travel times are significant. And the other part is maybe more of an inner city part where you have uninsured patients. We know that we have a much bigger issue that is very, very broad, and so we've come up with a three-phase solution. And yes, this is draft, this is for conversation, but short-term solutions, which would be from this day to the end of the year, midterm that would go from December 31st through September 30th, which is the remainder of our fiscal year, and then long-term phase 3, which would be December 31st of this 22 through 2024. And that's purposeful because if there is potential for funding, ARPA is an opportunity for that. We need to have that designated within 2 years. This obviously goes much longer, and the solutions have to be much, much further into the future, and this is more of a 20-year issue because we have to build on this over a period of time. I already mentioned initially uninsured patients. Some of the reasons that for-profit ambulances service is not making calls is because that if they make a call and make a run and the person is not insured, Medicaid, Medicare, or private health care, that makes it pretty much a free ride. And to get over the hump, municipalities really need to look at themselves and how they respond to their citizens. So either they need to contract directly, which I think the city of Bessemer is doing now, contract directly with for-profit ambulance service to create those services and have dedicated service, or the municipalities need to look at transporting for themselves. Another big issue is 911, and the first instance I'm going to let Keegan talk about Nurse Navigator, which is a program that can be used, but there's still some questions about it.
Hi, good morning, everybody. So Nurse Navigator was a potential short to midterm solution that was brought to us about a month ago. Essentially, this is a solution that we would potentially use to help ease the wall times at hospitals, 911 calls that are not actually emergencies that are not emergencies that require ambulance transport. So this is a remote program that uses licensed nurses that are registered in 36 states, including the state of Alabama. So they will come and partner with our local 911 centers, first responder departments, and essentially what they do is they will train the dispatchers to determine whether or not a patient is needing an ambulance transport. And if they decide that this is not an emergency, they will transfer the call to a nurse. The nurse will go through a triage program and essentially decide, okay, is this an issue that I can work through the patient with on the phone? Or they partner with Lyft, and if the patient does need to go to an urgent care clinic or something of the sorts, Lyft will be able to take them to an urgent care clinic. They also will be able to take them to a pharmacy to pick up their medication and then take them back home. If the patient does need an ambulance transport, then they can work that out to get the patient to the hospital. So this is a potential short-term solution that we are still looking into.
And there are still some legal questions about whether or not that's permissible through Alabama law, and so we're working through that.
I would think the liability would be an issue too.
It is, and the city of Birmingham did a version of this during COVID, where they had one of their paramedics that is also a PA, and they were able to help talk whether or not this person had COVID or if they needed something else. So we know it works in other parts of the country, is whether or not state law allows for it, but they are working elsewhere. And so we still have more to dive into. But if there are questions, I'm going to call on Donnie West, who's the Jefferson County 911 Director, to talk about, we need to go through what reasons are there to call 911 and potential PSAs, but it can also answer questions about nurse navigation.
Sure. So let's talk a little bit about nurse navigator. I think, especially with the fire departments, we actually dispatch more, around 36, as well as sheriff's office, for law enforcement. Utilizing that nurse navigator would probably be beneficial in the sense of there is a lot of citizens that's just, they call 911 just for trying to get their medications, trying to get transported to a non-emergency facility. I think that would play a significant role. It doesn't take out the ability to, constantly or continue our dispatching for, with our fire departments to both basic and advanced life support calls, within their districts. But again, that's something we need to talk about. There, since the report has come out, there's a couple things that we've done. One is called geo-routing. What geo-routing does, it basically goes to the device where the majority of calls that we get are from wireless devices, your phone. What it does is actually locate that individual that's calling and routes into the correct 911 center. So that's been in play for probably about 6 months. It's cut our transfers down in half. We also went to a new software program called CAD Power Technologies. The City of Birmingham, Jefferson County, City of Homewood, and the City of Hoover uses the same CAD system. By using geo-routing as well as the CAD to CAD, it has, again, the number of transfers. We were ranked number 1 in the state, and now we're below 10. So quite a bit of difference in that. The CAD to CAD is definitely beneficial. And like I said, Homewood and Hoover eventually will be coming on. But what it does is when the caller calls in and states what their emergency is, instead of us, if they're in the City of Birmingham and we transfer to Birmingham, they have to ask that same question over and over again when they're being transferred. That eliminates that. We basically, once we take the call in at Jefferson County, we put CAD notes in, we transfer it to Birmingham if that's where it needs to go to that jurisdiction, and they're able to read those CAD notes and not have to ask that caller the same call. The same information, what is your emergency address and stuff like that. So,
And CAD is computer
aid dispatching. So the other thing that we're looking into is our organization, along with Jefferson County, with Helen, is talking about doing more public safety announcements. What we mean by that is kind of whether it's written form, billboards, or even some TV, is to educate the general public when to and when not to call 911. I think that would cut down the number of calls that we get daily. We're averaging 2,000 plus calls a day. This may help in that manner, where emergency services are needed, absolutely. And, being able to get, we have a lot of people that call in for just general information, and that kind of ties up the number of call takers we have to take calls. And you can imagine if we have a wreck on the interstate, just about everyone that passes the wreck will call in. So we'll get a couple of hundred calls just on one incident. So it kind of floods us over. There's nothing we can do about that other than a kind of a quick response as far as where your emergency is. If it's the same one, we've got it, and it's a short conversation. And we also, the technology that we've got, once they call in, we can spot them on the map exactly where they're calling in. So typically we can, unless it's a secondary wreck, we can really spot exactly where they're at when they're calling.
Of those 2,000, what do you think is ballpark non-emergency.
Yeah, so I'm thinking somewhere around half, about 50%. Yeah. But again, they're duplicate, you know, in nature. There's several that are calling about the same call. And we mentioned in the report concerning consolidation, I would mention that we've got open discussion still concerning the municipalities that have their, own public answering point. We're having a conversation with them about consolidation and what that looks like in the future.
Can you tell us what the zip code of those non-emergency calls come from?
I can tell you, I'm going to require it and tell you exactly what it's.
35211.
I can guarantee you the emergency, they probably gunshot wounds. They come from over in that area.
They're all over Jefferson. Absolutely.
Well, is our mapping, I know you should get the same software, is our mapping the same with Birmingham?
Yes, we have actually 4 different maps. 4 actually screens that have different mapping. They're all mostly the same. Some have different levels and overlays of information, like the fire department hydrants and stuff like that. But our maps work together.
That's good. Anything we can do to help with that?
I think they're working, together. I think there are some enhancements we can look at. We're doing what's called a tower upgrade at this point. It's a migration of software to bring us up to a higher level. We're at what's called 18.1, we want to get to 23. So we all, when I say all the 911 centers like Birmingham, ourselves, hopefully we are moving at the same time, which keeps everything intact, updates on everything.
In the county, we have 14 PSAPs, public safety answering points. Donnie and Greg have done a great job doing the virtual consolidation, and the software that he's talking about helps reduce, instead of getting transferred one to the next, they're actually working together, which reduces the call time and gets somebody actually on scene quicker and more efficient.
Can you give me the information on the calls that's non-emergency, that we're getting calls from, like the area? I would like that to see exactly,
We talked about that yesterday.
the major investors like to be at making sure these cities know if it's coming from their city, they get a lot of non-emergency calls. Because I know the system was used, I know in Germany. I know this is the way they use it.
For like medical call or doctor calls.
Doctor calls.
Right. And that's something else that.
And that was in the 80s when they was
about.
doing that. 'Cause I lived over there for 4 years, so that's the way they did theirs. And that was in the 80s, so ain't no telling what they do now. In Europe. So,
Well, we definitely need folks calling for the right reasons.
Right.
So these guys don't end up with their transports in the hospital with wall time and sitting there waiting on patients, or waiting on scene for hours, waiting on ambulance service to come by. They're non-emergent versus emergent is for 911. Greg and Donnie are, depending on what we decide here, they'll continue on with developing PSAs and taking the next steps forward. The next item is capital needs. We know that there are some departments that have capital needs or have units that are towards the end of their life. We'll let Chris Willis, who's been dealing with that, talk about that.
In unincorporated areas of the county, we have 7 departments that transport currently, which daily that staffs about 13 ambulances. We also have several municipalities that cover unincorporated areas for transport services. Those 13 units actually take a good bit off our private services as well, so if they go out of service, that's going to put extra burden on the private services. We have a lot of issues with staffing. I think Chief Governor mentioned that in the meeting a few weeks ago. But we have some departments that have staff, but their resources are at the end of their line. And we have a couple that are to the point that they're, almost going to have to quit providing service because they don't have trucks to get to the scene. Currently, we have 7 immediate needs for capital. And we have been able to locate some chassis that are 3 to 5 months out for delivery. So that's where we're at on that. And then on top of those 7, we still have others that are aging out, but they're not quite as tired. They're just, need to be replaced within the next year or so. But
Do we have those 7 specifics in here?
Sir?
Do you have those 7 specifics?
I have them, they're not listed in there.
Okay.
He has quotes from 2 different.
I have a quote, the only place I can find them, I have a quote from one, and then the city of Warrior actually had just bid out a truck, and it was a little over a year out. So they have 2 quotes.
And some of the firefighters could maybe speak to it better, that ordering some units may take 2 years in queue. And right now, we were discussing yesterday that there is a location that does used vehicles that will sell them. There's not a lot out there on the used market. Is that correct? What's the name of that service?
Brindley Mountain Fire Apparatus.
So capital is definitely one of those things, and it is an example when during our meetings with the fire chiefs, Concord spoke up, and they transport for 7 districts, and so they're the ones that we need the units that they're making long runs, and so this is another way we thought we could help in the short term, which is also a midterm, because this is something that may continue over a period of time, and there may need to be more thought out capital improvement plan to be supportive long term.
ARPA funding.
Potentially. I mean, that's we had that conversation with Justin, and Justin has kind of tracked it down to see if it's permissible, and I believe it is.
Have you talked to the state?
Talked to Dr. Harris at the state.
Oh, it's everywhere.
Yeah. No, this isn't a Jefferson County issue. Actually, it's a nationwide issue. And that kind of goes into the next one. We did have a conversation with Dr. Harris, with the head of EMS for the state, and understanding that he is the chief governance person for EMS for the state. And it's up to him to determine the testing methodology, and over the last however many years, the National Registry has been the model that they've gone to. So if somebody tests for EMT or paramedic, that they could go from one state to the next, not too different from the nursing license. It's the same testing process.
Reciprocity.
Yes. So understanding that the education has to be changed up. Either we have to educate the folks that are going to go into EMS at a higher rate, because some of them are not passing. And I'll just say the passing rate is very, very low for the National Registry. I'm going to turn it over to Jim St. John to explain it in a little bit more detail.
Thank you. Good morning. There's several different models of EMS education delivery that are available. We have 3 programs in Jefferson County that deliver EMS education. 2 of them are under the junior college system and are subject to the Alabama Department of Post-Secondary Education. The other one's a private. And then there's also the Alabama Fire College, which can teach field courses, and they do that often in Jefferson County. And it's noticeable that the report noted very low pass rates. Well, that was for the programs that are located here in Jefferson County.
but the Alabama Fire College has a much higher pass rate on the National Registry exams. So what's different is an obvious question. Alabama Department of Post-Secondary Education oversees the public entities, and in doing so, they say, well, these students were enrolled for this course or this amount of credit and passed, and so they're graduates of the program. And there's really not a gatekeeper there that says, can they assimilate all that knowledge and synthesize it and pass the National Registry, which is the state licensure. But the Alabama Fire College isn't underneath the authority of the Alabama Department of Post-Secondary Education for about the past 10 years. They've got a review program that they put all their students through, and if the students can't pass the review program at the end of their instruction, the program director does not sign off on allowing the student to sit for the National Registry examination. So they don't have students that are likely to fail going forward and taking the exam, and it makes their rates much better. What's also notable, though, is that the number of students that are matriculating through each of those programs is very low. And then on top of that, they've got very low National Registry pass rates. But the Alabama Fire College has a lot of students, and a lot of them are passing. So they're doing things right there, but they also do have that gatekeeper. The problem with that is Alabama Department of Post-Secondary Education won't allow that kind of a pass-fail. Can this student move forward to test? So the thing that would be necessary is to prevail on post-secondary education to say, yes, there can be this gatekeeper test at the end of the program of instruction, and if they aren't responsive to that, to seek some help from the legislatures.
Would there be, like, from the, if you went to, not the fire college, you went to one of these other programs, aren't there review courses that they could potentially take before they go test?
They
so
can
they
do
that
that.
in nursing. We do it with the lawyers, right? Do you know? I mean, so there are those opportunities out there.
Like prep classes.
Well, it's you learn how to take those tests, basically.
Yes, there are those, and I've discussed with the Alabama Fire College since our meeting with Dr. Harris, would you be interested in putting together a program like this so that students from around the state can take this course or this program to help them do better on the exam. Now, would it be more helpful if it was a requirement that they have to be able to pass that? I think probably so, but that there is the opportunity for it being an optional thing also.
But that also gives you a peek into how these courses are doing if they can't pass the registry.
It does. It does. It's a great gas gauge for that. Thank you, Commissioner.
Thank you.
Good job. Thanks.
We still in conversations with staff on workforce development know that we have to do a better job of making these positions available, but also understanding long term that we're going to have to look at salaries, compensation, retirement. All of those have to be a big part of it, which I think I heard not only in the meeting with the chiefs, but also meeting with private ambulance service, that this has to be a higher level of pay for sure to make sure we keep them. Because one of the outtakes was, well, if they go through and do 2 years with a paramedic degree, pass the National Registry, why wouldn't they just take another 2 years and go and get their nursing degree, and then they don't have to stay in making runs at all hours of the night. They just have their set shift. And so we have to make sure that we're doing the best to keep them in place.
Not even sure they'd have to do an extra 2 years to get the nurses.
Well, that's true, yeah. For an RN or an LPN, yeah.
Or an associate.
Yeah. So you'll see that under workforce development, education, retention, wages, benefits, retirement, very important. And then back to uninsured patients, that still has to be something that we work with and municipalities have to deal with. And then the final is long-term solutions, phase 3. The report points to the creation of a public safety organization with countywide delivery of emergency services. It's something that we have, phase 1 and phase 2 have to come along before we fully understand what this is. We have plans right now to speak with mayors tomorrow, and then hopefully the fire chiefs, if not tomorrow, very, very soon. That this has to be a partnership. This has to be coordinated efforts to make sure that we have everybody's input based on what this feedback is from our initial findings. Some of it may be, as much as we've tracked down, there may be other ways that we need to look at things. And so without their input, we're not going to get to better solutions. And so this has to be a partnership with all of us. And so the document that got out early mentioned the potential for a county fire administrator. That was just an initial thought and what came out of the Fitch report. And so we don't want to put anybody in or there's no definition to any of this until we have further conversations. With that, that's kind of the basics of it. We wanted to make sure that the commission was aware, and if this sounds like that we were moving in the right direction, just would like a blessing to say, yes, continue on, and if there are things that need to be brought before the commission, then we can come through with more specifics on resolution or something along those lines.
It's a difficult situation, but good job. Appreciate it. Okay.
Steve?
Yes, sir.
Would it be beneficial for us, since there's such a large lead time on the ambulance, let purchasing go ahead? Try to get some of those in pipeline?
And that was a conversation we had yesterday on what, if we're working with our fire districts, how can we best support them? And that, I think, is to determine the best path forward. So between Justin and Chris and Theo, maybe that's a discussion they need to have, and then come back to the commission with, here's the correct path to go down. And we do need to get some stuff figured out when it comes to capital.
I heard way out, long lead time. Long lead time is something, if that's the path that we're going to do, we need to go ahead and pull that through.
So that's the quick solution.
I'll ask any of the chiefs, have you guys ordered anything? What is your lead time on getting stuff in?
You mean for equipment's sake?
Yeah.
Yeah, we're over a year and a half to 2 years now.
And is that on engines, transports?
Engines and transports.
I just ordered a fire engine, and it's not going to be here until February of '24. And we just received 2 ambulances out of our 4 fleet. And it took 18 months to get those
on the turnaround. So we got
problem real.
So what's the solution?
So the solution is that
carry on.
Made you aware of these, and the short term, mid term, and long term. If the commission blesses it, then we'll work with county manager's office, legal, and staff to come back to the commission with specifically these bullet points, which we'll start with not only PSAs, capital needs, but also working on getting to our municipalities and helping them understand their hurdles on if they need to develop transport, or do they need to work with for-profit ambulance service like Bessemer's done. Then we can make them aware of the process, and they can then they're at least aware of it, and they can take next steps forward. And then we'll continue to work with the fire chiefs and for-profit ambulance service.
So this
is a living document. So this is meant to change over a period of time based on new information that comes in. So short term would be between now and the first of the year.
Is to do what Birmingham did during COVID, getting the lift.
The Nurse Navigator?
Yeah.
I think we need to talk about it. I know Sonny Brasfield had some concerns about it when I talked to him. And so we need to double check and make sure the legalities of it. I think Florence, Lauderdale County was working on having that up and going by the first of the year. We just want to validate that it's legal first.
I know we got to do something like fast.
Yeah, I mean, it'd be interested in what the Board of Nursing input would be on that.
So, there are a lot of moving targets here. So this is, at least to come back as soon as we could to come up with next steps. If everybody's good and I can get just a general blessing, we'll take some next steps to get some other folks involved to come back and report back to.
So when would you let us know that? I'm good with.
When I'm ready? Not before I'm ready?
No, I'll be over there.
When you're ready?
I'm ready now.
Yeah.
We got to do
No, I
something.
mean, it's a serious, it's a serious issue.
Very serious.
No actionable items
Yes, sir.
will be on the agenda this week.
No, this is just initial information. We need to bring more information, and I think the most urgent would probably be the capital and the people in the workforce. So I think the capital would probably come first, because that's low hanging fruit.
We'll have hopefully an answer on our part, right?
Yes. We already have initial answers, at least for capital. So hopefully we'll come back soon and have more.
County Attorney? County Matt?
We have, I think, 24 employees, 30 years of service that will be at the meeting Thursday to PM. So I'll take a minute to thank you all for recognizing them. Looking forward to that.
Thanks for reviving that again.
Yes.
That means a lot. That means something.
And I want to mention the fitness room again. Hopefully during the new year, we will have something in place to help the employees stay fit because of the lower our insurance. I keep talking about this, but that is very important because we're working late hours and we need to have an outlet for them to go on a lunch break or either when they get off of work.
Sounds good.
We're adjourned.
Thank